One of the most physically demanding activities in the military is skydiving and parachuting with that. It's also one of the most common causes of back pain and long-term degenerative changes in the lumbar spine among military veterans. And I want to discuss that risk really briefly in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service, so you can get the compensation you deserve. Degenerative changes in the lumbar spine, whether that's degenerative disc disease, facet osteoarthritis, spinal stenosis, these are frequently observed, and this has been shown in a specific group of the military in the parachuting instructors, but you can extrapolate that or sort of expand that really to any military active duty service member, and by default the veterans after that did a lot of parachuting activities during their service. The authors of one study that I've read did x-rays of 47 parachuting instructors. They averaged 410 static line or skydiving jumps. And what they found on those lumbar spine x-rays, they found mild degenerative changes of the lumbar spine in 9.6% of them. They had moderate degenerative disease, so again, a little bit more severe, in over 10%, 10.9%, and severe x-ray changes in the lumbar spine in just over 5%. They saw bone spurs in just under 7%, and the degenerative changes correlated with age. So all of the wear and tear from the static line jumping and the parachuting caused or initiated the process of degenerative changes. And then as they got older, they developed more bone spurs, they developed more of these degenerative disc disease, the facet arthritis, the spinal stenosis, spondylolysis, which is a stress fracture, so to speak, of what's called the pars interarticularis, either at L5-S1 or L3-L4. That was seen in 12% of people. So lots of degenerative changes seen. This again was a study of military parachuting instructors, but I would argue the same thing happens to active duty service members that have to do it themselves, not necessarily the instructor, because a lot of military members do hundreds of jumps during their careers. There's no question that that would be a significant risk factor for the development of these degenerative conditions 5 years down the road, 10 years down the road, so be it. And again, these are not things that develop within 12 months. So this idea of a presumptive service condition isn't necessarily true. What you might have to do in a Nexus letter is get somebody like me that can argue what these conditions are, what happens at a microscopic level in terms of microtrauma to the bones, the discs, the cartilage, the ligaments of the lumbar spine, and how that develops over a long period of time, and preferably shows studies that show that, so that you can argue that those activities in the military caused the degenerative lumbar spine conditions 5, 10, 15, 20 years later. And that can be an effective argument, but it's probably one that you're going to need help with from an expert rather than trying to argue that and file that on your own. Now, if you're interested in learning more about the disability claims process, you can get a free copy of my new ebook, The 8 Most Common Reasons the VA Denies Service Connection for Disability Claims, and how you can beat them. Just click the link in the description below this video. Make sure to subscribe to this channel. Click the bell to be notified when I release a new video. If you're potentially interested in a Nexus letter for your orthopedic injury or condition, you can click the link in the description below. You can learn more about working with me and working with my team. We do everything we can to make the process simple, to make it as quick as we can for you. And I try really hard to write a Nexus letter that gives you the best chance of success in your disability claim. Thanks for watching, and I look forward to helping you much more.